If you are a man over 60, you have likely had a PSA blood test during your annual checkup to screen for prostate issues. Your doctor looks at that single number on the page, and if it is under 4, they usually tell you everything is fine and send you home. But what if I told you that a normal PSA number can sometimes be more dangerous than a high one because it hides what is actually happening? For years, we have been taught to fear a high number, but the real danger lies in the trends and ratios that most patients never even hear about. Today, I am revealing the specific PSA markers that actually matter for your long-term health and why your current normal result might be a false sense of security. We are going to look at the 3 critical signs that your prostate is trying to send you an urgent warning. Understanding these numbers is the difference between catching a problem early and letting a silent threat grow completely unnoticed for years. By the end of this video, you will know exactly what to ask your urologist during your next visit to ensure your safety. The first thing you must understand is that PSA is not a cancer test. It is simply a measure of inflammation and activity within the prostate gland. Many men over 60 have an enlarged prostate, known as BPH, which naturally pushes the PSA number higher without any presence of cancer at all. This is why a man with a PSA of 6 might be perfectly healthy, while a man with a PSA of 3 could be in trouble. The danger starts when we rely on a single snapshot in time instead of looking at the broader picture of how that gland is behaving. If your prostate is large, a higher PSA is expected. But if your prostate is small and your PSA is rising, that is a red flag. We have to stop looking at the number in isolation and start looking at it in the context of your specific body and age. Most seniors are never told that their normal range actually shifts every single decade as they get older, leading to massive confusion. This misunderstanding is why so many men feel unnecessary anxiety, or even worse, ignore a growing problem because their number was technically in the green. The most dangerous number isn't a high PSA. It is a fast-rising one, a concept medical professionals call PSA velocity. Imagine your PSA was 1 last year, and this year it is 2. Even though 2 is technically normal, that number has doubled in just 12 months. This rapid jump is a much bigger warning sign than a steady number of 5 that hasn't changed in 5 years of testing. Research shows that if your PSA rises by more than 0.75 points in a single year, your risk of an aggressive issue increases significantly. Your body is telling you that something is changing rapidly inside, and that speed is what should trigger a much closer look from your doctor. Unfortunately, many clinics only flag a result if it crosses the 4.0 threshold, completely missing these dangerous jumps in the lower ranges. You need to keep a log of your results from previous years so you can track the speed of change yourself at home. Never let a doctor tell you a fast jump is okay, just because the final result is still under the standard laboratory limit. The second hidden danger is a low, free PSA ratio, which is a specialized test that most men over 60 never even receive. While total PSA measures everything in your blood, free PSA measures the protein that is not bound to other molecules, providing a clearer map. If your free PSA percentage is low, specifically under 10%, it indicates that the prostate cells are behaving in a way that requires immediate investigation. Conversely, if your total PSA is high but your free PSA ratio is over 25%, it is much more likely just a simple enlargement. This ratio is the secret key that helps doctors decide if a patient actually needs a painful biopsy or just a simple follow-up. Most seniors walk out of the office with just a total PSA result, leaving them with only half of the medical story they need. Asking for a reflex-free PSA test can save you from months of unnecessary worry and invasive procedures that you might not actually require. It is the most powerful tool we have to distinguish between a harmless aging prostate and something that truly needs a surgeon's attention. The third factor you must watch is called PSA density, which compares your blood test result to the actual physical size of your prostate gland. A large prostate is like a large factory. It naturally produces more waste, which in this case is the PSA protein leaking into your blood. If you have a massive prostate but a low PSA, your density is low, and your risk is generally considered very low by specialists. However, if your prostate is small but it is pumping out a high amount of PSA, that density is high and very concerning. Doctors calculate this by taking your PSA number and dividing it by the volume of your prostate, usually measured during a quick ultrasound. This calculation is vital because it explains why the number is high, taking the guesswork out of your diagnosis and your future treatment plan. Without knowing your prostate size, your PSA number is basically like a speedometer that isn't connected to the actual wheels of the car. Insist on knowing your prostate volume so you can understand if your PSA number is proportional to the amount of tissue you actually have. One major mistake seniors make is taking a PSA test right after certain activities that can temporarily spike the number and cause a false alarm. Riding a bicycle, having a digital rectal exam, or even recent intimacy can irritate the prostate and push the PSA up for a few days. If you have your blood drawn during one of these spikes, you might end up with a terrifyingly high number that isn't your true baseline. Always wait at least 48 to 72 hours after these activities before going into the lab to ensure your results are as clean as possible. Even a mild urinary tract infection or a common cold can cause enough inflammation to throw your prostate markers into a temporary but scary tailspin. I have seen men rush toward biopsies and surgeries simply because they had a test done while their body was fighting a minor, unrelated infection. Always ask for a retest in 4 to 6 weeks if you get an unexpectedly high result before making any major medical decisions. This simple waiting period can save you from a lifetime of side effects caused by treatments that were never actually necessary for you. We also have to discuss the hidden baseline for men who are taking common medications for hair loss or an enlarged prostate, like Finasteride. These medications are very effective, but they have a side effect that most patients, and even some general doctors, totally forget about during testing. These drugs naturally cut your PSA number in half, meaning a 2 on paper is actually a 4 in reality for your body. If you are taking these pills and your PSA comes back as 3, your real number is 6, which would be an immediate red flag. This masking effect is incredibly dangerous because it can hide a growing problem behind a seemingly perfect and healthy-looking laboratory report. You must tell your lab technician and your doctor exactly which supplements and prescriptions you are taking before they read your prostate results. Failing to double the number while on these medications is one of the leading causes of missed diagnoses in men over the age of 60. It is a simple mathematical correction that could literally save your life by revealing the truth that the medication is trying to hide. Another critical factor for seniors is understanding that inflammation, or prostatitis, is actually the leading cause of high PSA numbers in older men. You might not even feel the symptoms, but a low-grade chronic inflammation can keep your PSA elevated for months or even years at a time. This inflammation isn't dangerous like a growth is, but it creates noise that makes it very difficult for doctors to see what is really happening. Many men find that after a short course of targeted antioxidants or natural anti-inflammatories, their PSA numbers drop back down to their normal range. This is why I always suggest looking at lifestyle factors, like reducing spicy foods and staying hydrated, to see if the prostate calms down naturally. If the number drops after a few weeks of healthy changes, you know that inflammation was the culprit rather than a more serious underlying issue. This proactive approach puts the control back in your hands and reduces the medical white coat hypertension that comes with every single blood test. Don't let a high number ruin your peace of mind until you have ruled out simple, treatable inflammation that is common in your 60s. As we look toward the future of men's health in 2026, new tests like the Exosome DX and Select MDX are becoming much more common and reliable. These are simple urine tests that look for genetic markers, providing an even deeper layer of security than a standard PSA blood draw ever could. If your PSA is in that gray zone between 4 and 10, these advanced tests can tell you with high accuracy if you truly need a biopsy. They look for the actual blueprint of how your cells are behaving, which is far more specific than just measuring a protein in the blood. Many insurance providers in the West now cover these tests because they prevent the high costs and risks associated with unnecessary hospital procedures. You should ask your urologist if they offer these liquid biopsies before agreeing to anything that involves a needle or a surgical center. Being an informed patient means knowing that the medical world has moved beyond just one single outdated blood marker from the 1980s. These modern tools are designed to give you clarity and confidence, ensuring that we only intervene when it is absolutely necessary for your survival. The real most dangerous number is actually 0. As in, 0 follow-up because you were told your result was normal for your age group. Never assume that a single good result means you are safe for the next 5 years. The goal is to watch the trend over time. Consistency is your best friend, and staying on top of your annual screenings is what allows us to catch changes before they become problems. If you have a family history of prostate issues, you should be even more vigilant about tracking your PSA velocity and your free PSA ratios. Your health is a long-term investment, and these numbers are just the data points that help us manage that investment for your family's future. When you stay active, eat a prostate-friendly diet, and monitor these specific markers, you are taking the most important steps toward a long life. You deserve to live your senior years with strength and independence, without the constant dark cloud of "what if" hanging over your medical reports. Taking charge of your data is the best way to ensure that you stay in the driver's seat of your own healthcare journey. To summarize what we have learned today, remember that your PSA number is a conversation starter, not a final and absolute diagnosis of your health. Watch your PSA velocity to ensure it isn't jumping too fast, and always insist on knowing your free PSA ratio if your total number rises. Check your PSA density against your prostate's physical size, and always account for any medications that might be masking your true and real results. If you get a high result, don't panic. Rule out inflammation, wait for any temporary spikes to settle, and ask for a retest in a month. Use the modern genetic tests that are now available to avoid unnecessary biopsies and to get the most accurate picture of your internal health. By focusing on these specific details, you are doing more for your prostate health than 90% of the men in the general population. Share this information with the men in your life, because most of them are still relying on outdated advice that could be putting them at risk. You have the power to protect your health through knowledge, and I am here to help you navigate every step of that process.